Witnessing as a laparoscopic surgery was performed on an elderly woman to remove her uterus was, to say the least, an eye-opener. This was at the International Center for Minimal Access Surgery, ISMAS, located at Parklands Mediplaza in Nairobi. Laparoscopic surgery is where surgeons are guided by video cameras to perform the procedure.
In gynecology, I'm doing everything now. I even do tumor surgery now. If there's cancers, we do early cancers and things like that. But things like fibroids, removal of fibroids, removal of the uterus, if there's a cyst of the ovary. For general surgery now they're doing appendicectomies, gallbladders, and several things.
During the surgery, 3 small cuts, about ½ an inch each, are made on the part of the body where the surgery will be performed, and plastic tubes inserted through the openings. The camera and instruments are then set up through the plastic tubes, which allow access to the inside of the patient.
So the first thing we do is we inject about 2 liters of gas into the abdomen. If we don't use gas, we don't have space to operate, okay? Like you saw just now, when we lost the gas, there was no space. So it's to create a virtual space in the abdomen so that we can operate.
The surgeon then uses the images from the video camera positioned inside the patient's body to perform the procedure. This can be done on all operations, including cardiac surgeries and ectopic pregnancies. However, it cannot be performed on cesarean births.
This type of surgery is about 25 to 30% cheaper. Because if you are fast with the surgery, if there are no complications, the blood loss is minimal. You don't require a lot of painkillers, all right? Recovery is faster, so if you equate cost and recovery, then of course you're saving there as well.
When Kezia, a 45-year-old mother of 3, was told that she had fibroids, it came as a shock to her. Kezia is a small business person, and her fears were that going through the surgery would mean missing out on business. Then a friend told her about laparoscopic surgery.
I understand this one, the healing process is a bit faster. And being a business person, I feel this one is better because I'll be able to go back to the office sooner than the other one.
Unlike in open surgery, where a patient stays in hospital for up to a week healing the wound, in laparoscopic surgery, a patient goes home the same day, no matter how difficult the procedure was. This is because there is less post-operative discomfort, since the incisions are very small compared to open surgery, and there is minimal loss of blood.
There are basically 2 reasons. One is the instruments that you use. We have the diathermy, which works on electric current, and then we have other instruments like the harmonic scalpel, which is a blade that vibrates at 55,000 cycles a second. Now, with that vibration, it seals any blood vessels and it will also cut tissue. But the other important thing is, in laparoscopic surgery, the advantage we have is we can identify the planes of surgery very well. So you try and avoid areas where there are blood vessels.
Opened in January this year, ISMAS, which is a privately owned facility, has since performed about 100 laparoscopic surgeries. Majority of them are walk-in patients, and others are referred by other patients who've gone through the procedure. The facility also offers laparoscopic training to doctors from the region.
There is a little training, but very minimal training in medical schools. It's more for postgraduate level, but still also very minimal. But yeah, centers like this are very well needed because this is the way forward.
It has so far trained over 50 doctors from Kenya, Sudan, Zimbabwe, Uganda, Tanzania, and Rwanda.
Where you have to develop the skill is you are looking up there, and through that view, I can do whatever surgery I want. And the concept here now is to train these younger doctors to develop the skills. Different items you have to approach differently, all right? It's more difficult to pick up something like this. All right? Okay? So this is the skill you have to develop.
ISMAS doctors also go to public hospitals once every 6 months to perform the surgery for free on those who are less privileged.
I think in today's day and age, because of so many advances, not only in medicine, in every field, it's important that patients should be informed about different choices or different options for whatever condition that they are being treated. Whether those choices are available locally or not, I think it's important that the patient is adequately informed whenever they are seeking medical intervention.
Laparoscopic is used in up to 90% of all surgeries in Western countries, but unfortunately in Kenya, we are still far behind.